Hey there! In this video, I want to talk about knee strengthening exercises. Hi, welcome back. This is Auburn Wei, your exercise physiologist. So, the other day I was just talking to somebody who asked me about how muscle function. And because from his background, he has been working quite a bit, but he's feeling something not quite right with his body. And I put it very general, so I thought it may help you if you are searching for, something to do with strengthening exercise, specifically your knee. So broadly, all strengthening exercises are good for your knee, right? Whether it's extension, whether it's flexion, whether it's adduction, whether it's abduction, it is good for your knee. The thing about this is, if you have a weakness in the joint, right? Certain muscles are not functioning properly, certain muscles are weak, and you haven't been able to strengthen it or to activate it to wake him up for some reasons. Maybe you have previous injury, maybe the way you're working out or the way you're training has neglected that muscle. There will be this muscle imbalance and muscle weakness. And no matter how much you do, right, for your strengthening, you will never get the muscle to wake up. You will never be able to use the muscle if something like that has happened before. And that's why when we do consultation, or when we go through some of the medical history of patients, we usually ask them, whether there's any injury before, because it tells us something, right? If you have an injury before and you have rehab properly, you have strengthened yourself properly, it may have lessened that problem. Most people will have pain or may have injury and they won't do anything, because once they feel no pain, which is just rest and not doing anything, pain subsides, pain went away, and they carry on. Now, using pain as a gauge is not the best thing, because it doesn't tell you whether your muscle is strong or whether your muscle is weak or your muscle have went into a sleep, right? Or only unless you do some tests and then you find out, right? So in general, all the exercises are good, but if you don't wake them up, if it's fallen asleep, it's not activated while you're doing the flexion, extension, whatever movement it is, you will come into problem, right? Think about it. If you only need to move in that direction, for example, you're trying to straighten your knee, you're trying to extend your knee, that's quadriceps at work. But why do you think we actually need 4 muscles for our quadriceps, or just by straightening our knee? Is there a need for 4 muscles? Can't we just have 1 muscle to do that? There's always a reason behind, right? In every angle, certain muscle becomes dominant. When you are doing the flexion, it is always best to have all 4 muscles fired, because when you train, especially when you lift heavy or when you have certain games, for example, you're an athlete and it requires you to be powerful, you have a powerful action to perform, your knee or the muscle may not be able to cope with the load. And that's why people strain. Of course, there are many other reasons, but this is one of them. If your muscle, for example, quadriceps, there are 4 muscles, right? one has been sleeping and not activated for many years, the other three are actually working very, very hard. If you can't imagine this, think about it as a workplace, right? You actually have 4 workers, but one of them is always going away and out of office. Can be taking medical leave, can be just taking vacation. The other 3 is going to work very hard, right? It works harder than normal, and it's going to tax them such that they can't cope with it anymore and they come into problem, right? So when you have that many muscles around that area, you better make sure that all muscles are actually working and functioning well. It's not by whether you are painful or not. It's not by whether you can complete that movement or not. It's by doing a series of tests, right? You have to make sure that your knee is functioning properly, all muscles are functioning properly, so that you can continue to train at a higher level, at a more intense exercise, or a more powerful movement, right? This has also to do with injury prevention. If your muscles are not working properly, you're going to get injured. And when you get injured, you're not going to train anymore. You're spending most of your time trying to recover, trying to make sure you have no pain, trying to make sure that you can move properly, trying to make sure that you can have a full range of motion, trying to make sure that when you are moving there's no pain, then your usual training can resume. You know how long this period is? It can take months, right? So best thing is you don't get injured. Although you don't feel pain, make sure you're doing all your conditioning work, right? Make sure it's all functioning properly. So all knee strengthening exercises are good, but you gotta watch out for some of these things, right? So that's all I have for you for your knee strengthening exercises. If you like my video, please subscribe. Please give me a like. If you have any questions, please post them in the comment section below. I will see you soon. Please take care. Bye-bye.